Welcome to the new hire orientation for the Anchorage Education Association school year 23-24. What is unique and different about Public Education Health Trust is we are a health insurance company that was started by its members. In 1996, Anchorage Education Association began offering health insurance to its members through PEHT. As a not-for-profit health insurance provider, our goal is to maximize your benefits at the least cost. The board, the governance of PEHT, is comprised of 7 elected education employees who live and work in Alaska. Also, every member of PEHT has the opportunity to be elected to the PEHT board. The board creates the plan designs, sets the premiums, and considers suggestions from its members for any modifications. PEHT has 3 local staff members that are here to assist you with any questions regarding benefits, eligibility, locating in-network providers in Alaska or the lower 48, and to work with you and your providers regarding any billing concerns. The language in the collectively bargained agreement between Anchorage Education Association and Anchorage School District determines who is eligible for health insurance. Once eligibility has determined, Anchorage School District will provide you with the attached form. Completion of that form notifies PEHT, who then will send you an email containing a registration link. All eligible individuals will need to register to select or waive their health insurance coverage. Proof of eligibility for dependents enrolled is required. Birth certificates for children and marriage certificates for spouses are required to be submitted within 30 days of the effective date. Dependents are not activated until certificates are received. Documents received after the 30-day window will have the dependents not be eligible until the following open enrollment window next year. Please reach out to PEHT with any concerns about meeting the 30-day deadline. New hire health insurance coverage will begin the first of the month following the date of hire. This is the form sent to you by the Anchorage School District that, upon your completion, notifies PEHT of your eligibility. When you have completed the Anchorage School District form, an email will be sent to the email address you listed. Remember, all eligible individuals will need to respond to enroll or waive their health insurance coverage. The email will come from My Benefits email account. If you have not received this email within 5 days of your ASD form completion, please reach out to the PEHT office as well as checking your spam junk folders. Anchorage Education Association has selected 3 different benefit plan designs to meet the unique needs of your family. All 3 plans contain medical, prescription, dental, and vision benefits. The underlying benefits of each are the same across all 3 plans. Coverage for oncology, rheumatology, cardiology is the exact same on all plans. The difference in the plan designs is the cost sharing, different deductibles, different out-of-pockets, and prescription co-insurance. All 3 plans also provide preventative care services coded as such by an in-network provider. They are covered at 100% with no cost to the patient. Deductibles are 100% the individual's responsibility on a calendar year basis. January through December, the deductible is paid 100% by the patient. After deductible has been met, PEHT and you begin cost sharing, where PEHT pays 80% of the in-network allowable charge and you pay 20%. Your 20% is referred to as your out-of-pocket or your co-insurance. Each plan design, again, has different deductibles and different out-of-pockets, co-insurances. Once the deductible and co-insurance caps have been met, PEHT then begins paying at 100% for in-network service providers. Plan C and Plan F have individual and family protections for their deductibles. An example, a family of 4 on Plan C. Each individual would not have more than a $500 deductible. However, the entire family would not have more than a $1,500 deductible. Plan F, each individual would not have more than a $1,500 deductible. The entire family would not have more than a $3,000 deductible. The HDHP plan is different. There are no individual protections under the HDHP plan. A family of 4 on the high deductible health plan, even if only one person accessed care, would have a $3,000 deductible. That is an IRS requirement. Plan F has a unique cost savings feature in that the first 6 office visits with an in-network primary care provider, family doctor, not a specialist, are covered with only a $25 copay for the office visit portion of the claim. If labs or imaging were needed, those would be subject to deductibles and coinsurance. Additionally, PEHT has partnered with Providence in offering access to their 5 conveniently located express care clinics. Your copay for the office visit portion is only $25. On the high deductible health plan, it is $25 after the deductible had been met. Prescription benefits. Plan C and F have a 30% of the drug's cost coinsurance. However, there is a maximum copay of $100 for a 31-day fill. The high deductible health plan coinsurance for prescription begins after the medical deductible. $1,500 for an individual on the policy, or $3,000 if more than one individual is enrolled on the policy. After that deductible has been met, the coinsurance on the high deductible health plan is only 20%. But again, the coinsurance on the high deductible health plan only steps in after the deductible has been met. If you are on an expensive monthly medication, please pay special attention if you are considering the high deductible health plan. Maintenance medications, those that are continually taken throughout the year, are required to be filled in 90-day supplies, which is actually a cost savings for you. A 90-day supply for the cost of a 60-day supply. Please reach out to the PEHT office if you have secondary coverage that requires you to only fill in 30-day supplements. There are some medications that are considered specialty. They're usually injectables or high-cost medications. Those are still covered under the PEHT plan, but with a 25% coinsurance and a $200 max if they are on the formulary list. Those are filled with only 31-day supplies, not longer. Again, should you have any questions, please do reach out to our office. Use of in-network providers and facilities is critical. Out-of-network benefits do not have a 20% coinsurance maximum. PEHT will pay 100% of the Medicare allowable plus 25% to out-of-network providers. We refer to this as Medicare 125. This could leave you with a hefty bill owed to those providers. When it comes to hospitalizations, both Providence and Mat-Su Regional are considered in-network facilities for PEHT. Other Anchorage School District employees covered by different insurance companies have Alaska Regional as their preferred hospital. PEHT has selected Providence. If you are seeking imaging, labs, or surgeries and are directed to Alaska Regional, please speak to your provider of the importance of you going to Providence. Please know that the payment to Alaska Regional will be significantly smaller, leaving you potentially with a large financial obligation. PEHT has partnered with Aetna to access their national contracts for discounts, and PEHT has partnered directly with many local providers who did not wish to join the Aetna network, but were interested in supporting public education. To locate an in-network provider, please visit the PEHT website and click on the Preferred Provider title. There, you can find the PEHT Direct Contracts list, as well as the link to the Aetna Local and National list. Additionally, if you have any questions if your provider is in a network, or if you are new to the area and are seeking a provider, feel free to reach out to this office and we will do the research for you. Dental and vision benefits are exactly the same across all benefit plan designs. For dental, there is a maximum of a $3,000 per calendar year per person benefit Cleanings are covered at 100% of the allowable amount with no deductible. Basic work, which has a $75 annual deductible per person, are covered at 80%. This includes root canals and fillings. Major work, covered at 50% after the dental deductible. This includes crowns, bridges, dentures. Again, the maximum PHT will pay in one calendar year is $3,000 for each member in your family. Vision benefits. When accessing a VSP provider, which the list can be found on our website, you have a $0 copay for exams and a $25 copay for frames or lenses. You can receive a pair of glasses each year or $170 towards contacts in lieu of glasses. PEHT has partnered with several quality firms to provide you access to great benefits. Please look for emails or mailings from these firms and know they are approved by PEHT. Several of the firms are VSP, which is Vision Service Providers. Optum RX are our pharmacy benefit managers. SupportLink, offering you 8 free counseling sessions per year. TransCare for access to medical tourism for elective surgeries, hip replacements, knee replacements, rotator cuff repair, carpal tunnel. Teladoc for 24/7 access to free medical care in whatever state you are in. If you're on the high deductible health plan, you will pay $55 copay for that visit. Lastly, EBMS is our probably most prominent partner. They are the third-party administrator we have hired to process and pay your claims. Please know that EBMS takes direction from the PEHT office. Should you ever have any concerns with the level of service you are receiving, please contact our office for resolution. Coming to a close now, and it's down to the cost. The collectively bargained agreement between Anchorage Education Association and Anchorage School District requires the Anchorage School District to make a flat dollar contribution towards health insurance for individuals who have enrolled in coverage. AEA distributes those funds across the plan designs and the differing tiers to arrive at the monthly cost for each employee. PEHT cares not who is in your household when it comes to the tiers. It is based solely on who you have elected to enroll. Your spouse or children might have coverage through their employer and you elect not to enroll them. You are not required to enroll them. However, if you do, these are the 4 tiers. Employee only. You are the only one enrolling. Employee spouse or domestic partner with no children. Employee child or children, you and 1 or more kids with no partner. Employee family, you with your spouse or partner and 1 or more kids. These are the monthly cost September 2023 through June of 2024. Thank you for your time today listening to this presentation. Please complete all forms sent to you by the Anchorage School District. If you are eligible for health insurance and have submitted your form to ASD, please look for an email from My Benefits to register, then enroll or decline health insurance coverage. Please remember all eligible individuals must register to enroll or decline coverage. Please begin gathering your required certificates if you are enrolling in dependents. Reach out to our office if you have a domestic partner. Again, contact our office with any questions. There are 3 of us serving 14,000 Alaskan belly buttons, so if we don't answer your call right away, please do leave us a message. Or often, email is the best contact method. Have a great school year.